You're listening to Word on Health with Paul Pennington. On air and online 52 weeks of the year. Taking you behind the healthcare headlines, this is Word on Health. 1 in every 600 children in the UK is born with a cleft lip and or palate. Cleft means split or separation. During early pregnancy, separate areas of the face develop individually and then join together. If some parts don't join properly, the result is a cleft, the type and severity of which can vary, as Rosanna Preston from Clapper, the only UK voluntary organisation specifically helping those with and affected by cleft lip and palate, explains.
Cleft lip and cleft palate are actually two different things. You might have one or the other or both. The most common likelihood is that a child will have a cleft palate only. That will affect their ability to speak and to feed. The severity could be anything from very small notch to the whole of the palate separated. Same with a cleft lip. You can either have a cleft lip on one side of the nose or on both sides of the nose. And sometimes the cleft goes right through from the lip to the gums and the palate.
Do we know what causes cleft lip and or palates, and can they be prevented?
Essentially, there's no specific cause. And quite frequently, when the child is diagnosed with a cleft lip, parents worry that it's something that they did, but in fact it isn't anything specific that they've done.
Talk us through the treatment options.
There's a whole 20-year programme, in fact, of treatment, and nowadays there are specialist teams around the country who just work with cleft lip and palate, so they're very expert at caring for babies. The very first operation you will have at 3 months, if you have a cleft lip, that gets repaired, and then the cleft palate will be repaired at around 6 months. Then as the baby gets older and grows up, there may be an operation at around 10 to 12 years. To make sure the teeth come through properly. And then later on there may be more operations to make sure that the bite is working properly and that the face looks balanced. If you've got a cleft palate, then there's more likely to be associated problems with something called glue ear, which is temporary deafness. So as the child is growing up, around 6 to 8 maybe, they will start to get this problem with their hearing, and that might affect their speech a little. They may also have problems with speech because of air escaping through the roof of the mouth and down the nose. And those are all things that can be looked after by the specialist cleft team.
What about adults?
Because services have changed quite dramatically in the last 10 years or so, in fact, a lot of those adults will not have had the same level of service that babies get nowadays. And they might be a bit unhappy with their appearance. They might want some more help with their speech. They can come back to the specialist cleft teams and ask to be seen again.
For further information on this story and links to organisations for further help and support, log on to www.wordonhealth.com. That's www.wordonhealth.com. You can also follow us on Twitter. Our address is @WordOnHealth. Word on Health, the award-winning health, lifestyle and wellbeing report with Paul Pennington. Word on Health, your personal prescription for your very best of health.